Well, good afternoon, everybody. My name is Greg Olsen, and I'm the director of the New York State Office for Aging. You know, we've been doing these Facebook Live information and resource sessions because our goal is to help individuals lead happy, healthy, and fruitful lives in their homes and communities. I'm really excited today to have Pat and Pat with me, and I'll formally introduce them in a second. Our topic today is addiction globally. When we talk about alcohol use and abuse, drug abuse, prescription abuse, and problem gambling, we know that that impacts people of all ages, all cultures, and all ethnicities. And very similar to mental health, it's not something people are often comfortable talking about, but we really do have to talk about it because people don't have to suffer in silence. Addiction can impact and does impact so many facets of our lives, but there's help for you. And that's what really today is all about. The pandemic, as we know, has made many, many things worse, whether it be the economic stress of losing a job or potentially losing a job, bringing the virus home if you're an essential worker, getting it yourself. We saw increases in child abuse, domestic violence, elder abuse, alcohol and substance abuse, and of course, incidences of mental health problems. What the public often doesn't see, though, are the partnerships that we have. And this is a great example of that. You know, we touch about 1.3 million people a year through the Office for Aging and provide a variety of community services. But what we don't provide is addiction services, prevention and mitigation. We don't provide mental health services. So we have to have partnerships, and that's what I think we do so well. And these two individuals that are joining me today have just been tremendous friends and tremendous partners, not only to the Office for the Aging, but to the older adults that suffer from addiction across the state. So let me introduce our two guests today, and then we'll dive right in. So I have with me Pat Zuber-Wilson. She is the Associate Commissioner for the Division of Prevention and Problem Gambling Services, OASAS. Position, she oversees the continuum of substance use disorder and problem gambling prevention services. The division is responsible for policy development and funding supports for evidence-based programs that reach youth, family, and communities across the lifespan through education programs, community-based prevention, and public awareness. She joined OASAS as the Director of Government Affairs and Federal Policy, and in that role, worked to lead efforts to monitor state and federal legislation, regulation, and policy issues. She has worked extensively with local, state, and federal elected officials, government agencies, federally recognized Native American nations, and other key constituency groups. Across her over 30 years in the public sector, Pat has worked at the State University of New York Research Foundation, the New York State Department of Social Services, and the New York State Executive Chamber. So Pat, welcome. And I'm going to introduce Pat Lincourt. She currently serves as the Associate Commissioner for Addiction Treatment and Recovery Services at OASAS. In her role, she oversees treatment and recovery services. She's implemented program aspects of several Medicaid reform initiatives, including managed care delivery, delivery systems reform and incentive payment, value-based payment approaches to addiction care. She has worked with state agency and private entities to develop training, clinical support tools, and technical assistance for programs. She has worked with OASAS providers to improve care through continuous quality improvement and the development of client and program level metrics. She has supported the development and implementation of recovery centers and the integration of peers into certified outpatient settings. She has a master's degree in social work from the State University of Albany and is also a licensed clinical social worker. So Pat and Pat, thank you so much for joining me today and for our ongoing partnership and, of course, your friendship. So let's just start with getting out of the way. Tell me what OASAS is and what it does and who it does it for.
Well, I guess I'll start and then I'll pass the baton to the other Pat, the Pat L and Pat PZW, that's what they call us. So from the prevention perspective, we work very closely with communities throughout the state to provide a range of prevention services, from meeting youth where they are in schools and community programs, to working with families, to working with overall communities to address substance use prevention and problem gambling prevention. And that's really some of the key work that we're starting to do now as we see expansion of gambling opportunities across the state is really to give people the tools to prevent disorders along the way. So, and our partnership goes with our division also to really look at how we can reach families through screening, brief intervention, referral to treatment, reach individuals before I need to pass them over to Pat's system of care. Let's get an opportunity to go in, do an intervention to really work with individuals. So we provide a wide range of prevention and intervention services in the Division of Prevention and Problem Gambling. And I'm going to pass it over to Pat Lincourt so she could talk about treatment and recovery services.
Great. And it really is a continuum, as Pat is, talking about prevention. Prevention often is relevant to people who are in treatment and vice versa. There's a lot of co-work that we do together, both for addiction, for all addictions, for substance use disorder, as well as for gambling disorders. So OASAS oversees all addiction treatment in New York State, as well as the recovery services. We fund, we oversee, we ensure quality, we manage, any difficulties people are having with access and with any complaints there are about the system, making sure that the providers are operating within our standards. So that's our basic function. Within that function, we also do a lot of interaction with providers and with community groups as well to learn more about what we as a state agency should be thinking about in adjusting and making available services that are needed. So as people are aware, there's opioids became a tremendous problem over the last decade and overdoses have increased and continue to increase during the pandemic. And so we and our service providers have really had to adjust the way we approach treatment, making medications for opioid use disorder much more available, approaching people in a different way. And so that's an example of how the state agency responds to addiction needs as they change over time.
Yeah, and you guys are really similar to us, right? So you have a network of providers that are doing the work. Not only you guys are as well doing the work, but doing the work on your behalf, very similar to us. So I know Kelly's going to put in the chat box the list of those types of resources at the community level, because that's really a huge part of what we try to do is not only provide good information, but make sure the connections are there. What I like about what both of you guys said is there has been so much more of a focus over the last 5 to 10 years on prevention, not waiting for something bad to happen and then dealing with the after effects. So let's talk a little bit about some of the prevention strategies, especially around prescriptions, right? We often talk about alcohol and substance abuse, and we'll get to that in a second, but it's not uncommon for the customers that we serve to have anywhere between 6 to 12 different medicines. And in later life, many people are on pain medications, which obviously could be, abused. So what prevention measures may older adults take really to prevent the misuse of prescription medications?
And that's a really great question, and I thank you for that. We are working with our prevention providers. There are about 154 of them across the state, in addition to about 180 prevention coalitions across the state that can provide support to programs that are serving older adults across our great state. They can provide things like prescription deactivation bags, which many of them have available. And that's really an important piece to, secure, dispose of, make sure you know where your medications are. I always relay the story of my late mother who had opioids for back pain, and she had them at her bedstand. Someone came in to do work in her house, and she called and said, I can't find my medication. That medication was gone. We searched the house, everybody, searching our family, and we came to realize that one of the workmen had taken her medication. So knowing what your medication is, securing that medication, and making sure that you have those deactivation bags, have those lock boxes to make sure you know what their medication is. So that's really a key part. And I think always engagement is something critical. And we have resources within our communities that we can really engage the populations of older adults like myself who you're working with. So I really understand, and we're here to be of assistance. I think Kelly also has the names or the link to our regional addiction resource centers. They can be another resource for all of your programs in terms of providing speaking opportunities to come and speak to your groups, to provide those things like those prescription deactivation bags and lock bags, all of those things. They're here to support and be your partner in your local community.
Yeah, and I'm glad you talked about those bags, the Deterra bags, because, we've been talking, the three of us and others, about, ways to get those out. It's not uncommon, again, for medications to be adjusted, or, you finished a set, but there's still some left. And you could have 20, 30 different pill boxes that not only you could take in error, but as you mentioned, whether it be a work person or a family member that might have a problem themselves, could wind up going in and taking them. So, proper disposal, whether it be taking them somewhere if you're able to dispose of them properly, or if you are not, and for many of the folks that we serve as well, having some assistance inside the home of getting rid of those old medications so that you're not having adverse drug interactions is critically important.
And
So,
Greg, can I just add one other thing? I think
sure.
it's very, very important that people maintain an inventory of their medications. That is very important. So you are aware if medications are missing or if medications have expired. It's a tool that we strongly recommend, not only with older adults, but all communities. Keep a track of those medications. It's very important.
So prior to us coming on, Pat Zuber-Wilson, you had just mentioned you just got a new report really showing what an increase in a public health problem alcohol misuse is among older adults. There's a population, again, if you're in your 80s now, you're born in the 30s, right? Coming out of the Great Recession, World Wars, Vietnam, it was just a different time. People used alcohol differently. We've learned a lot more since then, but then you got that article literally before we came on air today. What are some of the risk factors for alcohol and substance misuse for older adults?
Well, I think we older adults, and I can use the term we, things change. Things change. Our bodies change. Our environment changes. We have things, social changes. Our friends aren't able to do the things that we would used to do. And so it makes it really difficult. Those are some of the risk factors we see. Retirement. Sometimes you've gone from a very, very active life, work life, and then retirement. What am I going to do during my day? How do I end my day? You start taking medications. All of these things are risk factors. The economic stresses of being retired and having changes in your income. Life happens, and kids grow up and they move to other communities, and it changes your lifestyle. So that leaves a lot of time that really can add risk factors to substance use by older adults. And, we have to say that this has been a time of isolation for older adults. COVID, I know many of my friends said that they went months and months and months without really having that contact, that face-to-face contact with their family members, with their parents. So it's really been a difficult time. So we have to think about how do we address all of these changes in our life, in our bodies, also taking medications. Those are all part of the things that we think about when we look at some of the risk factors. And we hope to provide education, training, and other supports to address those risk factors. Pat, did you want to add anything else in to?
No, I think that's absolutely, I mean, I think specifically for alcohol, I think there's two major factors in terms of exactly what you're saying about the changes as we age, and alcohol having more of an effect and influence than we remember. And so people can continue with their same pattern that didn't cause problems, and all of a sudden they're starting to have some effects that they didn't notice. And then also, as Greg was saying, the amount that, the numbers of medications that people have very frequently, prescription medications have the kind of interactions that people aren't aware of, and they're not aware that their medication is causing maybe some of the effects that they're feeling. So I think those are two things to be aware of as an older adult, as I am as well, if you are choosing to drink alcohol, and to make sure that your physician or your healthcare person is aware as well.
Mm-hmm. And I think the key point that hit me, and again, I have not had a chance to fully read this study yet, but the two key points that really hit me were that substance use in older adults is one of the fastest growing health problems in the United States, and increased alcohol use adversely affects multiple aspects of one's life, including physical and mental health, as well as social and interpersonal relationships. And those two pieces just hit me again, literally 5 minutes before we got on this feed. So we've shared that information with your office, Greg, and hopefully we can people can take a look at that report.
Yeah, and I think that's so critically important, because there's a lot of facets to this. So, end of life changes don't necessarily, it's not a cause and effect, but certainly contributors. So, I alluded to how this impacts your health. It could impact a fall. It could impact you living independently or not, to your point. So I think that's right. But, I think when you retire, let's just call it what it is. A lot of people have friends or a neighbor, but where you really associate yourself, and that's our culture, is your work. And a lot of the friendships and relationships you have are with your work. So you have, isolation, you have the economic issues that you talked about. You might have a spouse that died, or, your brothers and sisters, and all of these things can potentially be a risk factor, as you talked about. And so one of the ways, to help combat that is to stay engaged. You could volunteer. I know the governor put a proposal in the state to lift the earnings cap, so we can, if people want to continue to come back to work in the schools or in healthcare and transportation, and staying engaged is a great way to reduce those risk factors. Now I want to shift gears here, because this concerns me. All of this concerns me, and I know it concerns you as well, and that's gambling. Now, we operate or oversee a network of over 800 senior centers across the state, and one of the things that they traditionally do is make trips to casinos. I've been to casinos. It's not hard to determine who the primary customer is. We now have online gambling that's come to New York, where, hey, if you just put $5 down and you win, we'll give you $1,200. And there is a balance between appropriate gambling and problem gambling. So talk a little bit about that for me.
Thank you. This is really part of the work that we are doing now, especially with the advent of mobile sports gambling. But I think some of the things that we want people to think about applies to if they do mobile sports, they go to a betting parlor at a casino, if they go to a casino. And, some of the things that we really want people to think about in terms of gambling is, first of all, set limits. Set limits before you even go into a casino, before you start that gambling. Set a money limit and set a time limit. And make sure that money limit is within your budget, because too many times we hear of individuals, it's really tough. You're there at the slot machine, and all of a sudden you win a certain amount of money. You're like, I'm on a roll, and you keep going. And in a blink of an eye, that $100 is gone. So set some limits for yourself, set time limits. And that is really just very important. And the other thing that we recommend from a prevention lens is limit alcohol when you're doing the gambling. When you're in the casinos will, bring you a drink to your machine. Really think about those limits: money, time, and the use of alcohol while you're gambling. So those are some of the key things that we really recommend. We also have, and this is one of those partnerships between the two PATs in our divisions, problem gambling resource centers across the state. And we've provided Kelly with the link to our problem gambling resource centers. They are really that link between the continuum of prevention, treatment, and recovery. They're available for speaking opportunities with your programs, to talk about some prevention strategies with your program, but they're also there as a resource. If someone has problems with their gambling and it becomes problem behavior and they need supports, they need treatment, they're available to help lead you towards those services. And I'll turn the back to Pat so she can talk about her end of this issue.
Yeah, so there are many ways to reach out to get help, including also in the chat will be the Hope line. And that's very well advertised at places where you can gamble as well. So you probably are familiar with that if you've ever been even in a casino or, driven by one even. There's often bulletin boards. I think it's hard, and this is true for substance use too. There's a lot of misconceptions, I think, about what addiction is that make it, and stigma about people who might have a problem that make it very difficult to, reach out or to recognize even when gambling or a substance use has gone into a problem area. And people, I think, are reluctant to reach out unless they get to, a really difficult spot in their life. But do recognize that, as Pat was saying about prevention, you could reach out at any time that you have any kind of a problem that's related to your gambling, even if it seems small at the time, to help yourself understand better, what's happened, and to make, a plan to not have it become a bigger problem. So it doesn't have to be a huge problem in order to get help. Good counselors are available across the state. They're very able to listen in a very non-judgmental way, to work with your family and you if you have a bigger problem and may have experienced some financial difficulty as a result of your gambling, help you get things back straightened out, and help you to understand better some of there are very good approaches to help people, cognitive behavioral approaches specifically to help people who are finding themselves in a little bit of difficulty. And it's okay to talk about, and it's okay to seek help. I know that our generation even it started probably more than our own parents to feel okay about seeking help, but we still have kind of, a reluctance to do that. So I would encourage anybody who's listening or who knows somebody who is having a little bit of difficulty even to talk to someone. And it doesn't have to be for a long time. It may be 1 or 2 times that you go and speak with someone. And, we have the resources here to help you to find that person.
Yeah, and I know we'll delve a little bit more of that in a second. We spend a lot of time at the state office talking about the value that older adults are to their family, their kids, their grandkids, their community, through their intellectual, their mentoring, their economics, et cetera. So I'm going to shift gears here because we're talking about how to link older adults that might have addiction issues in all the areas that we described. Now let's talk about them as a resource for their family, for their kids or their grandkids and other young people in a person's life. And what are some tips if you are talking or suspect maybe a grandkid or somebody within your family or your friend network? What can an older adult do to help educate?
Well, The role of older adults in the lives of young people is so important. I was thinking about this prior to our discussion today. My son's go-to person was my mother before she passed. He wanted to talk to his grandmother, and that is a very key role. Sometimes our kids don't want to necessarily talk to us. So grandparents and other loving adults, caring adults in a young person's life can really be a resource, really help support some of the conversations that we want families to have as it relates to alcohol and substances. And it needs to be small little conversations. It doesn't have to be the big conversation all at once. It could be you're baking with a member of your family and you just have a conversation, a safe space. Talk to them about what are your friends doing? What are some tools that we can help you in terms of figuring out some sticky situations? One of the things we recommend to parents, and I would bring it to older adults that may have a young person in life, is to have a telephone code with that young person to say, if that young person gets into a sticky situation, be it a party or whatever, where kids are using alcohol and other substances, have a code. Just, contact, text grandma and say, can you tell mom to call and say, I've got to go home? And that really that support, knowing that you have someone there to support you, is so important. And again, those little conversations mean so much and can reinforce things that parents are doing in other community supports. One more thing, since we just got off the conversation of problem gambling, that I want to remind everyone, lottery tickets, I think lottery tickets are not an appropriate gift for someone who's under the age of 21. I know that sometimes those are put into birthday cards and other greeting cards, or placed at a table during a holiday dinner. It's really not an appropriate gift. And so we ask that people think about that before they give lottery tickets to people who are underage. Just a little things, again, tips that we have. I've also provided another link that Kelly has for opportunities to talk to young people and ways to talk to young people in a way that's not only a nice, good conversation, but also that's age appropriate. So those resources are there. And again, we have prevention providers across the state that serve as resources.
Yeah, that's great, because I was going to ask you about, how you actually go about talking to people, and you've done that very well. So sometimes it's just the confidence to start the conversation. You might have a grandkid or somebody who, if isn't going to bring this up on their own, but if they have a trusted person like a grandparent or an uncle or an aunt or somebody like that, to just bring up the topic. And sometimes the floodgates just open. So I appreciate that, and I appreciate the resources. Let's get back to prevention. I'm a big fan of prevention. And if you're an individual or if you're a service provider, we're going to have both of those and many more listening today and in the days to come. How can they become involved in community prevention efforts?
Well, throughout the state, we have 180 community prevention coalitions. These are coalitions that focus their energy and their time into changing the norms within communities as it relates to alcohol and substance use. Within those coalitions, we have what we call the 12 sectors. And those 12 sectors are community partners who sit at the table with our prevention providers, with our treatment providers, with the faith community, with schools, with law enforcement. We all come together and think about what are ways to address substance use and prevent substance misuse in the community. These are tremendous opportunities for the organizations that serve older adults in the community, or even some older adults, to sit on these community coalitions to think about how we serve and how we address prevention within communities. We currently have an RFA out right now. And I don't know if I've gotten that to Kelly, but we'll make sure she gets it. We have an RFA for community coalitions for special populations. So what we are looking for within these coalitions is to really focus some of their energy and efforts and develop a plan for special populations. And guess what? We older adults are special population. So it may be an opportunity to start a coalition within your community or within your region or your county, specifically focused on the older population. We'll make sure you have that link. The deadline for the RFA has been extended to February 17th. So it's a couple of weeks, it's been extended. So I think it gives you enough time to look at that and also partner with those community coalitions. They want you to be part of the solution.
Yeah, and I know we started at the outset, or at least I did, talking about, you know, what the public doesn't see, and that's the state agency partnerships, and then the partnerships we all have with other sectors as well. And you know, we have talked about how we can better connect our area agencies and their providers with your coalitions. Because one of the things I know that you guys have shifted gears on over the last 10 years is a focus on older adults, where that was, you know, not that people didn't care, it was less of a focus years ago. And that's thanks really to your guys' leadership, and I appreciate that. So that's something we'll definitely follow up, because we should be at the table. And then, of course, you just cited a study you got 5 minutes before that makes it abundantly clear that there's room at the table for everybody. Let's talk a little bit about the specialization. So there are, you know, service providers dealing with, again, alcohol abuse, drug misuse, prescription misuse. Do you have any, or building them or shifting attention that really specialize in dealing with older adults specifically?
So we do. There are a couple, one in the Capital District. So if you're listening from the Albany area, that is specifically only working with an older adult population and very specialized in that treatment. There are other outpatient programs that, in fact, all outpatient programs and inpatient programs across the state work with older adults. We have a lot of people who are in treatment are over 55 across our whole system. Many providers do have specialized groups or specialized counselors who and medical staff that know the issues of older adults and really have a specialization in that. One of the things that we're going to do is to maybe not have a designation like we do for adolescent care, but to have some information available for people so that they can know which providers in their area are specifically working with older adults. It's also a question to ask if you were to reach out to help. You know, how do you approach an older adult population? Do you have any specific groups, or you know, are your medical staff trained or experienced in working with older adults? I think those are, you know, a lot of times I think people are just either grateful that they found a resource that's talking to them, or having difficulty finding anyone and don't necessarily do some of the interviewing on their side and you know, really find out, you know, do you specialize in gambling disorder, for example, and how do you approach that? It's okay to ask those questions and to, you know, expect to feel comfortable. And if you don't feel comfortable with the answers, to try someone else. That resource has been shared, how to find treatment. And the Hope Line too has some additional information, so you can talk to someone there about the resources that are available for treatment in your area. One of the things we're working on adding is that specialization to the Hope Line's view, so that they can see if a provider has reported that they have a specialization in working with older adults. But it really is a specialty. You want to be able to go into a group where you feel comfortable, where you're seeing people who you feel like you can relate to. And I think most providers are aware of that.
That's great. I appreciate you guys sharing those resources. There's so many ways that all the issues we're talking about, intersect, right? So, Pat, you were talking about don't overdrink while you're gambling. You talk about problem gambling and potentially the impact on your economics. Are you able to buy food or prescriptions? Does that lead to depression because you lost money, which then could lead to alcohol, right? So, I mean, there's a whole continuum of a kind of a ripple effect. How would you suggest, or some tips of how you can tell when recreational gambling has really crossed that line to where it becomes a problem?
I think I'll start, Pat, and I think that there's I think it's very simple. If there's any problem that's related to your gambling, even if it seems small to you, but like drinking, if you start having hangovers, that might seem like a small problem or just a part of drinking, but it's a problem, and it's something that that does signal that things are moving in a direction, and that's true of gambling too. All of the things that you mentioned, even if it's not drastic, but you had to postpone paying a bill because you used the money to gamble, or you got into trouble with a credit card because you had to pay something with that because you didn't have the funds because of the gambling. So you're having social your spouse or a child has come to you and said, I'm worried you're spending more time than I'm comfortable with. Those are all signals that to start paying attention. And it doesn't mean, that, sometimes people feel a little defensive about that, about somebody saying that, because they feel like they're being told that they are an alcoholic, or that they, won't ever be able to gamble or to drink or to, and that is being threatened. And I think, what I would say is to listen and to think about, you ultimately have the control. It's ultimately going to be your decision what kind of behavior change you make. And there are ways, and there are to start thinking about making small changes, and maybe moving toward bigger changes, and maybe not. Maybe those small changes can make a big difference, and your gambling kind of retreats back into something that's more recreational. So I think those are the messages I like. That I think that's some of the misconception that people have out there, is that a problem might signal something that's more drastic than it has to be.
Yeah, agreed. Can you repeat again how somebody can access more information about gambling?
There's our problem gambling resource centers, and I believe the link is been placed in the chat. And our problem gambling resource centers are a tremendous resource in the community, and they're available throughout the state. If there is, there's also our prevention providers, and we've provided a list and access to that. One of the requirements we have for our prevention providers across the state is that they provide at least 1 or 2 informational sessions regarding gambling. So you can reach out to our prevention providers. We have a curriculum for them, and they do provide sessions also. So there are numerous resources that we have available. And you can find them utilizing Find a Provider, and that those services are there. In addition, we provided a link to the problem gambling resource centers.
Great, thank you. And I know that, there's a couple purposes for today. So for individuals that might be struggling with some of these addictions, you often hear about denial, and denial usually is a public response. When you have crossed the line in any of these things. So I really encourage folks to be honest with yourself, and connect to these resources. And also the great advice and guidance you guys provided on a family member. You might not know what potentially is wrong, but you know something is wrong, and it's okay to not only raise the topic, you know, in a considerable way, but also to ask for help. And I know we do that across the spectrum. In our culture here, it's been often frowned upon to ask for help. And I think that's what we're all trying to undo, are these years and years of fear and stigma about asking for help as a character flaw when it's not. You're not alone out there. So if you are a family member with someone with a gambling or substance abuse issue, are there resources that can support them?
Yes. You know, one of the things that people should know is that you can seek addiction services as a concerned family member. And there are evidence-based practices that are specifically geared to family members. And, you know, CRAFT, which is a community reinforcement approach, it has two goals. One is to help the family member themselves because it's stressful and it's difficult to deal with someone whose behaviors you're really worried and generally very stressed about. And also, though, the CRAFT has been shown to be very helpful at encouraging a family member to get help, because the person who's concerned learns skills to be able to address directly the substance use without being, you know, confrontational, without being, you know, learning ways in which to approach the subject that tends to elicit from the person, you know, their own concerns. Like you said, Greg, a lot of people mostly who are having problems are very aware of those problems, and they may not feel ready to do something. They may not feel ready to even acknowledge that they have a problem, but they typically are aware that there's something that's you know, that's not right about their use, or and you know, when a family member learns some of these ways to communicate and they feel cared about, it tends to allow them to be more open to considering change. It doesn't happen 100% of the time, but I think, you know, most family members that I've worked with have been grateful for the opportunity to understand better what's happening and to get their own help and be able to start focusing on their own health.
We are also looking at other avenues, Greg, to really reach people before they need the services when there's maybe a problem. Screening, brief intervention, referral to treatment is a tool that is used in physicians' offices, emergency rooms. We are looking to spread that tool across the state in different venues where we can reach people and ask those questions, those key questions. How much are you drinking every day? Are you using other substances? And we're hoping that by having this tool available, not only for substance use, but there's a tool called GBERT, Gambling Screening, Brief Intervention, Referral to Treatment, that we're hoping we can reach people early on to have a conversation, to have that intervention, to really look at changing the trajectory of their substance use. And so that's a key part of the work that we're doing actually together, not only Pat and myself, but also conversation with your team at the State Office for the Aging. How can we reach people before we need to refer them to a treatment facility? So the more we can work together throughout your system and ours, I think it bodes well for the people that we serve.
Yeah, I agree. And, you know, we look forward to continuing our dialogue on how to do that, because as I said, you know, whether it be an agency or a particular issue, it manifests itself so many different ways, right? So if you are abusing alcohol and you're on 6 prescriptions and you fall and break a hip, well, then that has an impact on our home care program, our home delivered meal program, and so many other different things. So I think those, you know, the partnership is so very important. I do want to talk about stigma, because we have this issue, whether it be, again, mental health, addiction, could be a whole variety of other things, using SNAP benefits or getting HEAP because they've been, portrayed as something when they're not that, right? Talk to me a little bit about stigma and how this affects individuals and families in really getting the help that they need.
So I think that there is a lot of cultural kinds of messages that people have gotten about addiction that make addiction seem like it's a moral weakness or something that a person has purposely done to themselves. There's sometimes a punitive attitude toward it. People are ashamed if a family member, they don't want to admit to other people because of that, kind of moral judgment that they might feel from others. And I think that is, as we're learning more and more, I think people are becoming more and more aware that addiction, 50% of addiction is related to a person's genetics. There's such a biological factor that sets certain people up to once they're, they gamble, very recreationally, it's like a fair amount of the population, and there's something different about the way their brain is structured that just makes it very risky for them. And so we're that moral kind of judgment really doesn't belong to the addiction or to the person. It's more about how we've all been acculturated to think about addiction as being a weakness, and a lot less about the actual fact of the biology and the other kinds of factors that lead to it. And so I think that I've seen some change in people's attitudes, often when they know someone personally, or they're personally affected. I think that people can oftentimes overcome some of the cultural messages. When I think about some of the shows on TV that have depicted addiction, it's not in the work terminology that's been used to talk about people's addictions. That's where you can really understand how people have these attitudes towards someone with addiction that are completely not accurate. And addiction is only one part of a person. Somebody could be the most loving and generous and a person and very much respected in the community and have an addiction. And so that it really should be seen as another kind of a medical disorder that wouldn't be discriminated against, that you wouldn't feel blaming, or that somebody was weak because they had coronary disease. So that I think is a really unfortunate part of how we've all come to kind of understand addiction. And I think that we all have a part to play in trying to undo that, so that people with addiction are more able to seek out help, more able to make changes in their life, easier conversations around it because they're not feeling judged. So I'm so glad that you asked that question, because I think that it is, something that people don't talk enough about. And I think that, even in the audience, if people think about someone in their life who they've loved, have had an addiction, and most of us have had someone in our lives that we've known that have had an addiction, I think that there's a common ground that we could all understand each other a little bit better.
Yeah, I agree. I mean, a lot of things get hidden behind the family door. I can share that alcoholism is in my immediate family. My grandmother, who I hardly saw because of that, 3 out of her 4 kids are alcoholics. And so I have no problem sharing that, because your point is very well taken. The science and the biology is critically important. This isn't a character flaw. And again, for many things like depression, anxiety, mental health issues, addiction, it's not a choice for folks. And why we do these types of things, the work that you do, the education, the prevention, these types of information sessions is really to get beyond. It's going to take time, but we keep pushing the ball forward, that you don't have to be home suffering and placing yourself at risk, your longevity at risk, your economics at risk. I mean, God forbid a DWI, potentially killing somebody. I mean, there's so many ramifications to this. So I'm going to close by asking you to, and Pat Zuber-Wilson, you're on mute, an open-ended question. Was there anything that I didn't ask you, either one of you or both of you, that you would like the audience to walk away with? We have a lot of information that you guys posted on the coalitions and the networks, on prevention, how to talk to individuals, how to stay connected. We have plans in the works together to bring some of your resources and interconnectivity to the community level. But anything that I didn't ask that you want to leave folks with?
I think you asked all the questions. I just want to say that prevention from our end at the world of prevention, and I think our agency or treatment, it takes a village. I know I hate to use that cliche term, but it really does take a village. When we talk about youth, we know that if youth get services, prevention services in a school, in a community center, that they're going out into their community after they get that service. They're going home to family members. So it's not just one solution. It's many pieces coming together like a quilt. And it really does take the entire community and support of the entire community. So we look forward to that partnership. And I want to just also add one other thing. There are many kids out and about in our communities that don't have strong role models, that don't have the grandparents, that may not have loved ones in their lives. And many of the individuals that are listening today, many who are part of programs that you serve, they can be a part of the solution for us. So we look forward to not only providing services to older adults throughout the state, but also partnering with them to help young people, communities, and families across the state.
I think for me, I went into the field as a social worker into the mental health field, and I slowly transitioned to working more and more with people who had addictions. And I had early in my career a counselor say to me that she stayed in addiction because it was people change, people get better, people make big dramatic changes sometimes in their life for the better, and it's an honor to experience that with people.
Absolutely. Pat Zuber-Wilson, Pat Lincourt, can't thank you guys enough, your whole team at OASAS. We look forward to our continuing work together. As always, I want to thank Kelly Matija, who does all the behind the scenes to make these productions work. Check out the resources that we have listed. We will be seeing you next week to be talking about scams against older adults and how to not become a victim and how to mitigate that. And as always, please, if you haven't gotten vaccinated, get your vaccine. If you haven't been boosted, get boosted. Stay safe, wear a mask, good hand hygiene, social distance. Let's get out of this together. Thanks for joining us. We'll see you next week.